All right, good morning, everyone. We're about to start. So if you're here, please turn on your camera. I'll start sharing my screen. Let's see. Okay, so there we go. Okay, so we continue from where we left on Monday. And so to give you just to try to connect things. So on Monday, what we talked about, so in experiments, and the idea is, again, so we know the basic premise of experimentation is that you're inducing a new material to the audience, to the participants, in other words, and you're trying to measure the response in comparison to, and this is the key part, in comparison to the non-existence of that materials, right? So if it's an experiment about video games, you're comparing playing video games to non-playing video games. If it's about playing online group or like collective online multiplayer games or whatever that thing is called, you would compare that playing with multiplayers online to, let's say, playing individually. So the idea we say that experiments is always about comparing it to something. And that's the point of conducting experimentation. You want to see if the vaccine worked for people who took it versus people who did not take it. And that then you could think of this idea like in all things we do, even okay, and so then we talked about, okay, so if you want to do that, how do you do the comparison? That's when we said it could be within the same group, so that the same group gets the first treatment or play the first type of game or watch whatever video you're experimenting with, and then they take it again. Or you do two, like you do two groups. One group sees the manipulation, one group does not. So that's what leads us to then you can, and then you could do combination of both. So same group, different manipulations versus different groups, also different manipulation. So how many designs you can come up with an experiment? So we will start with the most basic one, which is not quite an experiment. So this is a quasi, what we would call a quasi-experimental design. And this is the idea that you have a group, you introduce an intervention, and then you test how they responded to it, right? And so you can think of this like in terms of like field experiments, right? Like you have, let's say, a group of followers, let's say, and we do this all the time. And so you introduce a new material. Let's say you introduce a new type of like a quiz, online quiz, or like a type of a game, and you invite your followers to play it. And you want to see if that will increase engagement. And so this is like an intervention. You introduce the participant group with no prior knowledge of how they feel about you as a brand. Imagine, for instance, we're teaching like online courses, and so I just started the semester. So let's say I, as an instructor, has no prior knowledge of you before, and so I introduce some new ideas to the course, right? So let's do more panopto quizzes and all of that. And so this is an intervention to a participant group, but I had no prior. So right here, let me. Sorry, you had no baseline right here. So this is yeah, this is unknowable, and there's no comparison group right here. Okay, hence we call it, it's quasi experimental. So it's sort of an experiment, but you're just seeing a progress like of one group, so you cannot compare it to something else, right? So this is mostly used like in practical research more than academic research. So imagine you're running an advertising campaign, or even with advertising campaign, you should have a baseline. But like you're just starting a new business, let's say, and so you're trying different things, different messages that could appeal to people, right? And you didn't have a prior knowledge, and you cannot afford having a comparison group. Then there's also another type of a quasi-experiment in which you actually do have a baseline, right? Okay. But the thing is, you're lacking a comparison group. And so this could at least show you a progress within one group, but its problem is called the meantime effect, right? So here's an example. I mean, I have one here in the slides, but like effects of adopting new wearable device. So for instance, you have new patients signing up for a program. So let's say it's a rehabilitation program post, let's say, cancer treatment. And so you pre-tested their level of commitment to treatment, or like if they keep up with taking their medication or their visits and whatnot. And so you have those measures before, and then let's say in the 6th month, you introduce a new wearable device that could track everything, like their heart rates, how beats and blood pressure and all of that, and also has schedule for what to do when. You could see progress, but you cannot tell if there's a meantime effect. And what we mean by meantime effect, you know, when you start something and then at first, right, you struggle and then you get an nag of it, and then you do more, then you perform more appropriately. Then let me give you an example. Like our class, right? I am sure your level of comfort and familiarity with the materials relating to research methods at week 1, week 2, week 3 were pretty limited, right? And so if I see a progress from in the how you perform in the final exam as opposed to the first exam, that could be just due to the time, right? You spend more weeks, you had more exposures, you read more materials, so you evolve, and then in the final exam you perform better because you had better experience. But I cannot attribute it to something an intervention I introduced in the middle of the semester, right? So we started to do Panopto videos. So your performance in the final exam, if it improved or even if it goes down, I cannot tell for sure if it's about something I did at the middle of the semester, or it's just because, yeah, it's just like you took 15 weeks and you learn more stuff, and so you perform better. That's what we mean by the meantime. And you could talk about customers for, say, you just started a new taco truck, and 1 month passed, 2 months passed, 3 months passed, and in the 5th month you started, let's say, social media campaign, and then a month later sales started to go up, but you don't know for sure. It could be also because of word of mouth, right? Because there's one place, 2 people, 3 people walked by it, and then they tried it, they liked it, then they talked to another 10 people who tried it, and then they told another 100 people, etc., etc. So we cannot tell which one goes what, right? Because we don't have control of those external variables. And that's, remember, the point of experimentation is like you want to look at the causal relationship, right? So that's why we call that also a quasi-experiment. Here, the time series design, or like it's also called one group pre-test, post-test design. And that's like you have 2 interventions or more. So 2 points of intervention. And then you detect the changes after each one. So this is actually repetitive. So here you would have a post-test And then here you would have a post-test. And imagine if we have a third test, you would also have a post-test afterwards, right? And so here you're having different interventions, and then you would measure the response to each one. I like to say, for example, I make you watch a series of ads, and after each ad, I'll measure something like your brand attitude or your willingness to purchase or something like that, right? So here I'm comparing, actually, it's one group of people, but different conditions, so 2 or more. Hence, that would qualify as a full experiment because I have more than one condition to compare. So we will watch a video. Think about the conditions that we're talking about, and what this experiment is trying to measure. So let's play this clip and let me know if the audio is not working or something.
Babies this young are extremely responsive to the emotions and the reactivity and the social interaction that they get from the world around them. This is something that we started studying 30, 40 years ago, when people didn't think that infants could engage in social interaction. In the still face experiment, what the mother did was she sits down and she's playing with her baby, who's about a year of age.
I'm like a girl. Oh.
And she gives a greeting to the baby gives a greeting back to her.
Yeah.
This baby starts pointing at different places in the world, and the mother's trying to engage her and play with her. They're working to coordinate their emotions and their intentions, what they want to do in the world. And that's really what the baby is used to. And then we ask the mother to not respond to the baby. The baby very quickly picks up on this, and then she uses all of her abilities to try and get the mother back. She smiles at the mother. She points because she's used to the mother looking where she points. The baby puts both hands up in front of her and says, "What's happening here?" She makes that screechy sound at the mother, like, "Come on, why aren't we doing this?" Even in this 2 minutes, when they don't get the normal reaction, they react with negative emotions, they turn away, they feel the stress of it, they actually may lose control of their posture because of the stress that they're experiencing.
I'm here. And what are you doing? Oh, yes. Oh, what a big girl.
It's a little like the good, the bad, and the ugly. The good is that normal stuff that goes on that we all do with our kids. The bad is when something bad happens, but the infant can overcome it. After all, when you stop the still face, the mother and the baby start to play again. The ugly is when you don't give the child any chance to get back to the good. There's no reparation, and they're stuck in that really ugly situation.
Okay, and so my question is, so what is condition A and what is condition B in this experiment? Someone tell us what they were experimenting with in the short video we just saw?
They were sort of just testing like infant reactiveness, like when their mother interacted back with them, and then when the mother didn't interact with them.
Yeah, so they were so emotional and verbal and emotional or facial interaction. So that's the variable. So that's the variable being manipulated. So what's condition A? What was the first one?
The mother was engaging with the baby and
Yes.
cooperating.
Yes, and condition B is?
The mother is not engaging with the baby.
talking? Yeah, go ahead. It's actually go ahead.
When the mother is not engaging with the baby?
Yeah, yeah. So mother is engaging, mother is not engaging, and so did they try that on two different babies or the same baby?
Say baby.
Yeah, same baby. All right. So this experiment basically, so you would have different babies, right? But they will all be one group, and each mother would do this type of an experiment in her own baby twice. So they would go through the first condition, and then they would go through the second condition, right? And so the variable, right? So the first variable, as Julian has said, is that yeah, it's called communication reciprocity, or like, let's say like interaction. So emotional and communicative interaction. And what's the dependent variable? They wanted to see what they wanted to see what? What's the outcome they wanted to predict? The response of whom?
The response of the baby.
Response of the baby, right? And so there was okay. So there's like a communication style or lack thereof from the mother, and the dependent variable is how the other side, the baby, would react. And so you can see here, same baby, two different outcomes, dependent on the first condition, right? Which is, or like the first manipulation, which is, are you going to be in the interactive condition or the non-interactive condition, right? Uh, so that's one bit. So what you could see, because they use the same baby, what's the benefit of using the same baby? Why didn't we just compare two babies, one with an interactive mother and the other one with a non-interactive mother? What would be the issue with that?
Both the babies might react in different ways.
Right, right. So what Ray is saying, like, so different babies could react different ways. So you could say, for example, that, well, some babies are not bothered if their mothers don't look at them, right? Or, but, or like some babies are just more happy in general. But when you did the same experiment on the same participant or baby in this case, so you could see the change from condition A to condition B. So you cannot attribute that to something we call individual differences, right? And so this is one benefit of doing one group pre-test intervention, post-test intervention, post-test, is that you can control for this issue. Okay, we might have individual differences. Yes, Ray.
So just to reiterate what you're saying, so you said the independent variable would be the baby, and then the dependent variable would either be condition A or condition B. Is that correct, or is that different?
So the independent variable is the predictor, is like the manipulation.
Oh, okay, got it.
Which condition? Yeah. By the way, the terms independent and dependent are just weird. So dependent variable makes sense. It's the variable dependent on the first variable, right? The independent variable is something that exists regardless of what the reaction would be, right? But the idea dependent variable, in this case, the reaction of the baby is dependent on which condition they go through. Hence the name. You can think of it, they call independent an independent variable, or they call the predictor and outcome. And if you think of it as predictor and outcome, it makes more sense, just intuitively. And so that's, we need to do one group, two tests, or two interventions, two tests. Then we have also the two group post-test design. So here, the issue is, so you have no pre-test, but you can have control for the mere time effect, and you have control for sensitization effect. And I'll explain that in a minute. But you see, for example, like, what if you have a carryover effect? So let's say, for example, I want to see how you react to horror movies. any gross visual materials, let's say. See, I want to see how people would. I'll give you an actual experiment. Let me ask you. So, do you think people's appetite? Think about this carefully. Do you think people's appetite increase when they watch horror movies, or if they watch comedy? Which one do you think increase appetite more? Comedy or horror movies?
Comedy.
Horror movies.
Who says comedy? Can you raise your hand? I know you don't know, but just intuitively, what do you think?
Wait, did you say increase appetite or
appetite.
decrease?
And increase appetite. Which one? So,
Okay.
do you think comedy increases appetite? Raise your hand. Okay, so we have 1, 2, 3, 4, 5. Okay. Do you think horror movies increase appetite? Huh. Interesting. Right. Santi, could you tell us what's your logic? And I know this is fully intuitive. So, what's your logic? Why do you think that?
Yeah, it's hard to have a logic behind it. I don't know. In my opinion, I think comedy would increase your appetite more than a horror movie was. I mean, what? Because I think if I'm watching a horror movie, like normally, if it's scary, I would be like kind of like tensed up, and like my appetite is not. I'm not thinking about stuff like that. Whereas comedy, I'm more relaxed and I'm laughing, and I feel that like my appetite would. I don't know. That's just me personally.
Yeah. Actually, you're right. So you're sort of right because it's actually more complicated. But in general, and people even saw that with the sales of like comedy actually does increase appetite. Imagine like, and think of it, you're laughing, you're happy, yeah, you would like subconsciously start to eating things, right? So that's yeah, like comedy, and even just having fun in general. So when you socialize, when you're friends, you're laughing, you're drinking, you're telling jokes, you're playing pong or anything, right? And you just start eating, right? And so yeah, like being just in a good mood in general increases your appetite. Horror movies is the opposite. In some cases, there's an exception, and which you're gonna say in a minute. But horror movies, right? Imagine you're being faced with a predator. You don't think let's eat something. You would think about running or like finding a shelter. The same with horror movies. You're just taking that horror or thrill, and so your appetite would decrease. But here's the issue. So if I'm doing this experiment, right? I take one group, I let them watch short clips from a horror movie, and then we pause for 1 minute, and then they watch comedy, and then I'm testing the effect after each one. What would be the issue with that if it's done on the same group?
Can you repeat the question again, Professor?
Yeah, sure. So I take one group, so assume I just have one group. I will let them watch a horror film or clips from a horror film. I take the post test about appetite. Then I let them watch comedy, and then let them take the post test about appetite. What would be an issue with that design? What do you think would be a limitation?
I feel like it would negate it. Like you can't really. It's hard to tell. Like if you're trying to measure which one has what effect, because you included both.
That's exactly right, Anna, which is like each one would negate the other. So the technical term for that is the carryover effect, because if you watch a horror film, so imagine it's effective, like it's a good horror film. There would be an emotional baggage being carried over even while you're watching the comedy you would still be watching, you still be remembering, it would still be active in your thinking, right, about what you just saw. So if it suppressed your appetite or increased it, it would be carried over even to the post-test after the second intervention, right? So that's called carryover effect or sensitization effect. And so when we have two groups, so no, one group would watch a comedy, one group would watch a horror film, and then we do the post-test, right? Or if you just want doing it individually. So here, for instance, the effect of watching horror films on emotional engagement. So we would do one experiment. One group would watch horror film, and another group would watch nothing, right here. And then you would see in the post-test of emotional engagement would increase. So this has been done. So do you think watching horror movies increases the need for emotional engagement? What do you think? This was a true experiment, by the way. Do you know what emotional engagement means or not? Okay. So it actually increases it. And so emotional engagement means, or like need for relationship. It actually, when you watch horror films, slightly you would have a higher tendency, like to call friends, to go out on a date, to visit your parents, something like that. So that's, we compare horror films to non-horror films, and then comedy to non-comedy. If you want to do, okay, actually here, if you want to do two groups, and so if you have two manipulations and you want to compare them to one to the other, you would have two interventions and then one post-test for each group. So there's no contamination or carryover effects between the two, right? So the horror people in the horror condition won't watch comedy, people in the comedy condition won't watch horror. So you would control for that. So this is, and obviously you have a pretest. This is a key difference. So you would know what the level of appetite, let's say, or the level of emotional engagement, or the need for romance, for example, before the intervention and then after the intervention, right? So you have a baseline for each group, and then you have a comparison benchmark, like one group, each group would be a comparison benchmark for the other group. So that's really why they would be called two comparison groups, right? As opposed to having like one manipulation group and one control group, right? So when you have a control group, one group won't see any intervention, right? And this could be done. You need a control group sometimes because you want to control for the mere time effect. So you want to see, yeah, like after 1 hour, people could get hungry without watching anything, right? So you want to get that, the baseline. And then you could do two more interventions. So by the way, those things are not mutually exclusive. So you can here actually have then a control group with a post-test, right? So then you would have three conditions: horror, comedy, and nothing. Pre-test, post-test. So you have a baseline for each group, and then you have benchmark comparison points from each group to the other, right? So that's you control for the mere time effect, and you control for the carryover effect, right, or the sensitization effect, as we call it, right? So yeah, so another, let me show you another example. Wait, sorry. Okay, here we go. Right. Yeah. So this is like two group. Yeah, we have a pre-test and then a post-test design, right? And still, by the way, this is the most commonly used. Is to have two groups, pre-test and post-test. Okay, so those are things you need to be aware of when you read experimental design papers, So first of all, was it a real experiment? So if there's no comparison in terms of time, i.e. having a pretest, or in terms of another group, then it's a quasi-experiment and not a full experiment. And then you look, okay, did they compare the group to itself, or as a matter of fact, or they compare the group to another group, right? And each one would have like advantages and disadvantages, right? Um, we said, for example, in the example we saw about the kids and the mother, we said different kids could have different communication styles, and so doing that experiment on the same participant was actually necessary because they want to see how their reaction would change, right? But if you think about the example we gave, so if you do have a large sample and then large group for each condition, so we had, let's say, 50 participants in the horror condition and 50 participants in the comedy condition, there could be, by the way, some individual differences. So there would be some people who actually watch horror and like to eat, right? Or people who, when watching comedy, don't like to eat anything, right? There could be some individual differences. But the idea is, if you do have like a control group and you have a pretest, then you could compare that, right? So apparently in the control condition, you would see the average. So this would represent the average, right? Okay. And so if the comedy condition is more than the average, then yes. So even if some people would prefer to eat while watching horror, but overall the comedy condition is higher than the average. So we would say it has a positive effect. Okay, so this is an example of. Will you tell me what this example is of? So which design they follow? So let's watch this video.
Emotion is a nonverbal language.
Is your tummy ticklish?
Emotions reveal the cognition, the understanding of the baby. And furthermore, emotions are the nonverbal communication of the baby towards the parent and the parent towards the baby. So therefore, I thought that emotions were a royal road, one royal road, to the study of the baby's development.
In this study, babies between 9 and 12 months are brought into the lab and placed on a large plexiglass top table. Half of the table has a checkerboard pattern just underneath the surface. But halfway across is the visual cliff, which the baby can tell drops off steeply. The plexiglass top continues, so it's perfectly fine to proceed. But the baby isn't so sure. And this is a big drop for a baby just starting to crawl. She wants to get across to get the toy, but she's cautious and looks to the opposite end of the table where her mother is. The parent is instructed to smile or make a fear face.
If the mother is posing a fear face, the baby typically does not cross this stair step downward, this modified visual cliff or visual step. On the other hand, if the mother poses a smile or somehow poses a nonverbal communication that is not prohibitive but encouraging, the child is much more likely to cross over to her. This particular study demonstrates the role of nonverbal communication in determining the child's behavior in uncertain contexts. A baby will, when they encounter something ambiguous, something uncertain, will typically look to the significant other, the mother, the father, a grandparent, the caregiver, in order to figure out what to do. So by 11 to 12 months of age, the baby is already doing what all of us do when something unusual happens. We look around to figure out how other people are reacting.
And yeah, and that's what we mostly do at the airports if you don't know where to go. So right, so in this video, what are the two conditions? What are the two conditions in this experiment?
Scary face and like the more accepting happy face of the parent.
Yeah, scary face, happy face, right? And by the way, in this particular experiment, the video was sort of like it's montage, obviously, but they actually had two separate conditions. So they had babies with sad, like scary face mothers, and babies with happy face mothers, right? Why do we need a comparison in this experiment? What's the point of having a comparison?
Because the reaction of the baby crossing over to like the quote unquote cliff is dependent on the reaction of the mother.
Right, right. So the independent variable here was not, by the way, how the people, how the what the baby, who the baby is. The independent variable was like what the mother would say non-verbally to the baby, right? So if the independent variable here was if non-verbal cues, if babies could interpret non-verbal cues from significant others, in this case their moms, right, when they are faced with a dilemma, right? But there's also an interesting issue, right, which is like how would the baby like go over the cliff, quote unquote, right? What a third condition would you introduce to this experiment? So we had like a happy face, a scary face. What do you think a third condition that we could add to prove the study?
Maybe like a neutral face for a baseline, like
Right. Yeah, that's exactly my same idea, Julian. Right. Like that's exactly what I'm thinking. Yeah, if you have a none, so if there's like a neutral or control condition, so you have right, Ulissa actually. So I'll go back to what you just said in the chat. But yeah, if you have a mother with an encouraging face, and then a mother with like a scary face, and then a neutral. So either the absence of the mother or the mother shows no like emotional uh, 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 reaction at all, right? Or emotional expression at all. So yeah, Ulissa, your point is right about the toy. So that could be. We could also do two conditions in which we have like a personal encouragement and then a material encouragement. So one is like a mother inviting you to come, and then or we could just place a toy. And but that would be a different experiment, right? So will babies be willing to go over a cliff if there's enough like reward at the end, right? And that's like but that's a different experiment, right? So here the independent variable is different. So it's not about the reliance on nonverbal communication. It would be about reliance on rewards. And yeah, like so you could put like a toy or like a bowl of candies, right? Babies those age should not eat candies, but like the point. It's like yeah, like there's some type of like a material reward, and we'll see how the babies react, right? So yeah, that's like a two group, yeah, with two groups post test comparison,
Emotion.
right? And so that's so those things you could tell then why we say and it's we're gonna like end soon. So this is why we could say like experiments could have claims and establish them because I could show you the change between one condition to the other. So it's not based on observation only. It's not based on subjective experience. It's not based on one-time cross-sectional survey design. It's actually based on demonstrating changes in reaction to manipulation, right? Let me give you an example. Think about like how you can do different manipulations. So here, there's this different like hypothesis claim, and I'm going to ask you to propose not a full experiment, but just like an idea for experiment. So like participants who view a news story with a negative ending will be able to recall more storyline items than those who view a story with a positive ending or a neutral ending. So how many conditions we have in this hypothesis?
3.
Okay, so yeah, we have a negative ending, positive or neutral. And what's the dependent variable?
Whether they're able to recall more
Yeah,
story
yeah,
items.
yeah. So recall, item recalls. Good. A different hypothesis. So students who have a friendly instructor in one section of speech class would express a greater level of engagement than students who have a socially distant instructor in another speech class, right? So how many conditions we have?
2.
Okay, so we have two. So friendly, which is the independent variable is instructor friendliness. And what is the dependent variable?
Level of engagement.
Right, okay. So yeah, so you see, like I can manipulate that. Here now, let's look at this one. Students in small class with female instructors would experience lower level of communication apprehension than students in large classes with male instructors. How many conditions we have in here?
4.
Okay, that's good. Could you list them?
Yeah, it's there's small classes, large classes, female instructors, and male instructors.
Right. Okay. Right. So you have have a large class with a female instructor, large class with a male instructor, small class with a female instructor, and a small class with male instructor, right? And what's the dependent variable? What's the outcome being studied here? Anyone?
Communication apprehension.
Right, so communication apprehension, right? This is what we would call a 2x2 design, right? So one would be, right, so a 2x2 design, right? So again, so now you have the two independent variables, class size and the gender of the instructor, large and small for the first variable, and then male and female for the second, right? And you could also add different things. So if we had, let's say, sexual orientation as the third independent variable, so it would be, let's say it's straight versus LGBT, so we'd have 2x2x2, which you will end up having 8 different conditions, right? And so this is important when you think when you read something, they tell you like, if it has 2 independent variables, definitely it would have more than 2 conditions, because at least each independent variable has to have at least 2 conditions. So 2 independent variables, you are at least going to have 4, or could be more, right? If we, let's say we want to see how students react to like transgender, let's say, or gender non-binary instructors, so we could have here like a third condition. So it would be 2x3, and you have 6 conditions, right? So this is the idea of like having independent variables, and how each condition in the experiments represent the categories of the independent variable. So that's it. We'll pause for now. Do you have any questions? Okay, so if that's the case,